Leslie Ziegler with the Digital Health Summit, and we're here at UCSF. And right fresh from the stage is Ira Parkey. Hi.
Hi.
Welcome to this stage with Ropes and Gray. So can you tell me a bit about what you do and your role and what the firm does?
Sure. So I'm an attorney in the healthcare group at Ropes and Gray. I focus on privacy in the healthcare sphere. So that means I work with providers, payers, technology companies, even people who are vendors or contractors with any of those folks to help them meet their privacy obligations and to help them respond if there is a privacy incident. And I have colleagues at the firm who touch on privacy issues from other points of view. They deal with data licensing, intellectual property issues. They work on privacy issues outside of the healthcare sphere as well.
So tell me what happened in there for all of those who couldn't be here today. What was the hot topic on stage?
Well, we had a great discussion about privacy and data security issues in the world of digital health, and we had a panel with people from really every slice of the world. We had someone with a venture capital background, someone who deals with information technology at a big healthcare provider, and someone who is from a company that works closely with healthcare providers to help them launch digital health technology in their practices. So we really had all points of view on the table, and we talked a lot about what the privacy and data security issues are that face everyone from the inside out, through to the question of what do venture capitalists perhaps look at in terms of privacy practices of companies they're examining.
So from your perspective, what's kind of the number one thing that you would say, people can take away from the session?
I think people can take away the fact that everyone feels somewhat skittish and somewhat underinformed in a very rapidly changing regulatory landscape. It is strangely comforting to hear everyone say that the state of play legally is in flux, and it can be a little confusing. And I think the other interesting message was everyone realizes there's a lot of attention now being placed on vendor relationships, so the relationships people have with their contractors and subcontractors, and trying to make sure that all of those folks down the pipeline are also complying with their privacy obligations.
Fantastic. So if someone out there is watching and wants to get in touch, what's the best way to do that? On Twitter, LinkedIn?
So we have a website, ropesandgray.com, and you can link to the Digital Health Group through that website and reach us.
Great. Well, thank you so much for being here today.
Thank you for having me.